So let's just spend a couple of minutes on some slides. I think a lot of this is going to be stuff that's very familiar to you, but I want to use it to orient those who have not used a partnered approach before and are scared to death of the messiness of it, and make sure that those of you who have always used a partner approach understand that this is rooted in a very long-standing field of community partnership and community collaboration, which strengthens this kind of work. So how to get to a community partnership that shares wonderful meals together. Well, the first step is to identify stakeholders. And, stakeholders is one of those terms that's thrown around. It's really just any person, any individual, and or organization. So that individual is a representative of that organization or that organization, regardless of who the representative is, who has a stake in the community assessment. Now, you might need to think about this in a slightly different way in regards to a community assessment, because we typically think of those who have a stake in a particular program or a particular health issue. Public health is split into these disease areas. It's the way that a lot of our funding from the federal government comes. It really annoys me because I like to think of my work as being very upstream preventive, about community development as an upstream prevention strategy for all health diseases. So I don't want to apply for a grant that's just going to look at diabetes. But because of that, sometimes we're in these, silos. So we're used to thinking about people who have a stake in particular health issues, but a community assessment can reveal issues that are, much broader and well beyond the camps that we sometimes find ourselves in health. And so we might want to think more broadly about who might be a person or organization who has a stake in the community assessment. They could also be those who have access to the community, leadership within the community. And so, the stakeholders are the usual ones that you think about if you do any kind of community-based work. Community leaders, the members or residents themselves, of course, all the decision makers and policy makers and elected officials. Here in Philadelphia, we have very strong block captains, and so I would put them in that category as well. Being if you are focusing on health, healthcare providers, hospitals, healthcare systems, especially those that do charity care, that already do community health needs assessments because they're a nonprofit and have to be able to prove that they do things for community benefit in order to retain that nonprofit status. Any health agencies, local health departments, Access Matters, any of these kinds of nonprofit or other community-based organizations or advocacy organizations that have a health focus or social service or housing focus if that happens to be your focus. Neighborhood or civic associations, kind of back up in community leaders, but to be sure to be here in West Philadelphia, we do everything with the civic associations, and we're doing a lot of work in the schools with our new Promise Neighborhoods grant, which is not even in my bio yet, but I am working on that as well. Anybody who's here, we can talk about that. That's a huge undertaking. But working with parent groups and school leadership and school district leadership, of course, is a part of that. So depending on what your focus is, you might think of another whole slew of stakeholders. Voluntary groups, work very much in West Philly with senior groups and youth groups and cleanup groups and, and folks who are more voluntary. And of course, religious and faith-based organizations which have strong community partnership and advocacy, and sometimes health ministries or youth ministries as well. So there are many, many others, but you need to think about stakeholders for an assessment in the sense of who can help to access the data or opinions that you will be looking to be sure to collect, and then also who's going to have a stake in what you found, right? And it could be that you identify more stakeholders as results come in. Wow, it turns out we had no idea, but transgender violence is the #1 concern of the community, and maybe you didn't have that, coalition up front, and maybe you need to now quickly go find those stakeholders. So you want to think broadly in the beginning of the planning phase, but also the results themselves might, make clear who else needs to be at the table. So there's a series of discussion questions in the curriculum. By the way, I will make these slides available. Somebody taught me not to make slides available before you present them. So I will give you guys all of these slides after the course, so don't worry, you don't have to jot everything down. But in the curriculum, there are these discussion questions to think about. First that question that I open with, what defines the community? Is it the entire population of the state of Virginia? Is it the population of the city of Richmond? Is it a particular neighborhood within Richmond? Is it a particular social group, like a racial ethnic group, a socioeconomic group? a religious group, a refugee or immigrant status group. So, really thinking about defining them, and that might lead you down a different path in answering these questions than maybe the usual folks who show up at all the committee meetings. You know those people, you're probably all among them, right? Who are on all the chronic disease work groups or on all the access to care work groups. Those of us in Philly, we all know who each other are, right? But when you think about defining your community, then that leads you to answer these questions in a way that might be a little bit more specific toward that population, that community that you're hoping to focus the assessment on. So what social institutions exist in that community, which might impact health? I mean, since we know that health is impacted by social determinants of health, we could argue that all of them do, but maybe thinking about those that are really health focused and starting there, which have an interest in health issues. For example, I work some with Rebuilding Together and Healthy Row Homes Philly here in Philly, and they're really focusing on not just keeping people in their homes and helping with mortgage help, but also the fact that home repairs and effective remediation of lead and mold and things like that have an impact on health, and so they're interested in health even though that's not their primary mission, right? Then thinking about the voluntary organizations, we talked about the clubs, the associations, organizations, support groups, faith-based, social networks. This is how things get done. This is what brings especially community leaders and members to the table of the community assessment. Kind of need to be vetted through this in order to gain real partnership and access. So I would start there as well. And then who are the respected leaders, who influences decisions. It's not a good idea to ever go with one spokesperson for a community, but to get multiple diverse opinions, and people are nodding because they probably had that experience. You want to make sure that you're not accidentally partnering with someone who either doesn't have a respected reputation in the community or everybody knows is a troublemaker. And so it's good to open your arms wide for a community partnership. Positive image. And then is when we start thinking about who would have the most expertise to help with this, to plan it, to conduct it. Who must be involved? Because if you don't, they're coming anyway, right? Everybody knows those folks too, right? And those organizations too. And I would say here in Philly, without the civic associations, without the Philadelphia Department of Public Health, I mean, there are just certain agencies that should be on board. And then who above do you think would most use the results? To make sure that the results and any data that is generated by this effort is useful, maybe even beyond what your initial purpose is. Maybe it could be data or results that could be useful for all the different agencies that are focusing on health in the community, to create this program or this service or to advocate for this, that, or the other. Let's make your results, useful in lots of different ways. So once you've identified the stakeholders, then of course you want to invite them. Of course, this is simple. Of course you want to invite them. A community partnership, another word, coalition, collaborative. There's some arguments about that there are slightly different dimensions of these terms, but it basically means a collaboration of people as individuals and or as representatives of organizations that work together on this project, shared project, but they're coming from their own separate identities. Right? So they're all bringing kind of a piece of the puzzle from their various agencies, and they all have expertise that's important for this. That community member has just as much expertise as that survey research methodologist, as that epidemiologist from the Department of Public Health, right? So it's recognizing everyone comes with their own piece of the puzzle, their own expertise, and so partnerships, community partnerships, tend to think of themselves as a little bit more equitable than maybe some other hierarchical organizations or groups that you might bring together. I like to argue, so the benefits, pooling resources and skills. It can expand the reach of your data collection, and then also the use or acceptability of the results. It makes sure that all those diverse perspectives are included, that the results are widely distributed, that you're vetting those results too. There's nothing more embarrassing than drawing conclusions that are just simply wrong. You could look at the same data points and two different people could interpret those data points completely differently, based on their experience living in the community or their experience, in some other context. And so it's really important to make sure you have all those voices around the table so that, especially if you're going to be using this to inform policy, to push for advocacy, to get funding. You want to make sure that those results are as defendable and rigorously created as possible. And so also you need a collaborative process so that it leads to the solutions. Like I said earlier, the buy-in for program services, policy, advocacy, whatever it is that you think needs to come out of this, that you actually have the beginnings of your implementation group around the table already. So forming a partnership can be challenging, right? So sometimes it's hard to make clear the benefits of participation, especially, and I will tell you as a researcher, about collecting data. You know, people are just, especially in cities that, you know, have a lot of academic institutions and hospitals that are always collecting data. You know, research is kind of like a four-letter word, a bad word in certain communities, and I totally get it, right? The old school way of doing research is the researcher comes in, swoops in, collects data, doesn't report it back. If they do, it's sort of meh. And then they leave, and then people are like, whatever happened with that? And then that person, you know, is gone. And people say, didn't we already answer that survey about, like, food deserts, right? So people are skeptical. So, you know, it's important to try to invite all stakeholders to participate and to come up with benefit statements about how this will be different, how this will benefit the community, what their role could be, you know, and that this isn't just some token coalition or partnership or, you know, community advisory board, but that you guys are going to work on this together. That's what I like to do. And, you know, and doing that by determining what level of participation each is able to or wants to contribute as part of that. That's what our first step is going to be. And then also assessing collective resources and skills so you can see that this could be done, you know, within our partnership. And then to figure out what's missing, right? Who else needs to be around the table? Do we need a couple of, you know, biostatistics interns from the Drexel School of Public Health? Then maybe we should reach out. And, you know, do we need some other allies to help us get the word out, either about data collection or results? Then we could reach out and ask for some more stakeholders to come to the table, to come to the partnership. And I always advocate for, I know this is hard, I'm sure that you guys all have your own experience about this, but there's always those controversial folks, right? Either in the community or in leadership positions. Everybody is laughing right now. I love it. And, you know, my policy has always been, let's just create an open invitation. Let's deal with the issues now and just get them out in the open because they're going to come up, right? If you don't address them, if you don't invite that person, then it's going to be even worse, right? So, you know, and I think that it helps to build ownership. People who just want to make a big stink but don't want to do work, I just find that they go away by the third or fourth meeting, right, when they realize, like, oh, this is actually going to be a lot of work. And I've said my piece and I'm going to go home now. Next couple slides are about well, first of all, characteristics of a successful collaboration, and we all know this, right? But sometimes it's helpful to come to a group with this list of, you know, of characteristics of a successful collaboration, or have a discussion about, you know, about these things, about group norms, as Shadia said, you know, shared goals and interests, inclusive governance that allows everyone within the group to have a role and a say, shared responsibility and input, shared ownership and commitment. Now, no group is going to have all of these things, but it's a good place to start about talking about what we want as a group and how we're going to try to achieve these things. Trust, you know, can be an issue, especially with two groups that might have had had bad blood between them before, or individuals. Balance of power and influence. Who's going to be doing that kind of ongoing management and support? I know in the group Shadia and I are in, who's creating the minutes and what's in the minutes has become an issue. Clear roles and responsibilities. Ground rules for maintaining a safe atmosphere. Safe atmosphere is one where everybody feels that they can speak their mind, that their perspectives are being considered, that the agenda is moving forward, that their reasons for joining the group are actually being fulfilled and not being derailed by somebody's particular concern, right? And that also means active participation by everyone in the group. And so sometimes when you establish these ground rules and you discuss these, you know, characteristics that you decide as a group you want to have, you can return back to them when folks around the table feel like they're not happening. What's great about a community assessment is that you kind of have to move through the process. it's a little bit easier to have a shared process than it is necessarily to create civic leadership. And so the structure of the process I've found can actually kind of push aside some of these issues a little bit, because those who are going to actually get the work done end up being the ones who come to the meetings. And those who wanted to just distract or do something else tend to just go away because they realize it's not going to fulfill what it is that they had wanted to fulfill. So at the end, of course, effective leadership and good consensus building and conflict resolution, I have these down here because, of course, these are the most important. And so what I like to do is start out the process, and Shadia is going to laugh at me because I didn't do this in our group, but it wasn't my process, is to assess everybody in the partnership, assess their capacity. It really helps you to figure out what resources, skills, and assets you have. It allows you to see what's missing, and it allows you to sort of get to that, what is everybody's interest here, and what are you willing to contribute in order to further your interest and contribute to this process. So, you know, this is just all the reasons why it's important to do it. You know, figuring out assets, figuring out limitations, figuring out where to invite more. But I just want to emphasize here to see where everyone's coming from. Sometimes it takes a few meetings to actually see where everyone's coming from. But if you can try to get that out on the table early, it makes it easier to kind of either head off some of these issues or reveal a little bit more openly some of these issues so that they can be dealt with. And it'll also help you to see the potential reach of the assessment results when you see, you know, sort of who everyone's networks are. So some of the ways, yeah.
Do you have a number of partners that you would say is like the max you would recommend being on a team?
That's a really great question. I don't have an answer to that. I went through this process, and I do Yale New Haven Hospital's Community Health Needs Assessment, and it is like a multi-sector, collaborative, like every group that exists in New Haven is on it. And I was actually able to move that group through developing a 110 question survey that we do every 3 years. Now, all those naysayers like left, you know, but like that's a large group and that worked. But I've been in groups of Shadia of like 12 that have not been able to get going. So I think it depends on the personality. I mean, I think the leaner and meaner probably the better, but sometimes there are ways to have multiple diverse voices in the group, but have working groups or steering, you know, groups or whatever, those who are doing, you know, maybe is more aligned with their mission and they're able to dedicate some staff time or something like that. Maybe there's more of these more intensive working groups. So I'm gonna say that it depends. So some of the capacities that I like to assess, and that's what is our step 1 worksheet. And there are others that would be important, I think, in your context that I'm sure you can think of as I'm going through this. But I find it's really important to see what everybody's mission is. It helps you also, it's sort of a pat on the back to be like, wow, we really have a lot of shared, you know, overlap in our missions. It also might allow you to see where someone's organizational mission might be very different, and it might sort of clue you into some, you know, some conflicts you might have. And then clientele or patients, right? Who are they serving? Who are they representing? And that's a really good way to see overlap as well. And also see where you're not representative, right? Funding. I put funding on the first page because funding is really important for this. Either you've already gotten the funding and that's what brought you together, or you're going to have to seek the funding. And was it Kelly? Kelly's the funder. Kelly's going to be everybody's best friend by the end of this workshop, I'm sure. But, you know, those who have the funding or those who have access to funders or those who are like, you know, are willing to write a grant for this, you're going to want to assess that right up front. Staffing is another huge resource, maybe even more important before funding comes down, right? So, you know, community health outreach workers or case managers, patient navigators, folks who are already comfortable speaking to members of the community, access them on a regular basis. You know, that might end up being really important to you if that's how you're going to be assessing community need. Those who, you know, can crunch data, those who, you know, have whatever skills might be needed to moderate a focus group or something like that. So I think not only staff time, but the kinds of skills and expertise and experience that they bring. Organizational support, right? It's one thing if you represent an organization, but you're doing this on your own personal time. It's another thing if the Philadelphia Department of Public Health is asking you to join this group and is dedicating a portion of your time or other organizational resources like data or meeting space or clinic waiting room hours or whatever it is that you might need to be able to conduct your assessment. So that's really important to assess up front too. I've mentioned skills and organizational support, but data and research capacities are really essential to assess. And it might drive what methodologies you use, which is fine. Or if you decide this research question, we're going to get into this, is a mapping question. There's no other way we can answer this question except with GIS processes. And there's no one with GIS expertise around the table, where you might change your methodology or your research question, or you might reach out and try to bring someone in with that kind of expertise. So that's how we kind of reconcile that. But there's all different processes of the research process, which we're going to go through over these 2 days. And you might not have been thinking about those who can produce pretty graphs that are user-friendly for community audiences. I mean, you guys know, I pluck the students here at our school who are really good at infographics and word clouds and data dashboards, because that's a particular skill. And if you're communicating results to community members, they can't be reading complicated figures that you need, 3 years of training to understand. And so along with research skills are also technology, actual technology, software, laptops, tablets, electronic health records, whatever is needed. And folks don't often think about this, but I think I immediately start thinking about media, how you're going to get the word out, either outreach and real local, hyper-local media, or larger Philadelphia media, especially when you're getting to results and, oh my God, this is something we could be affecting Pennsylvania policy or Philadelphia policy. Making sure that you have those outlets to put the pressure, on various audiences through the media or through various policymakers. And that's where the allies come into, policymakers, clientele, if people have a great functioning community advisory board or research advisory board, or, like I was saying, in churches, like a health ministry or youth ministry, just thinking about who those allies might be, either to conduct the work or to disseminate the results of the work, or to get to that next stage of planning for solutions or getting funding for solutions. And then the last slide is, what is their particular interest in the community assessment? What do they want to see happen as a result? This is where if I'm facilitating this process or a part of the process, I might kind of caution people, like, you don't know what we're going to find. We might find something completely different than you're hoping for, right? And it might be that you come in from the HIV department, and this is what happened to me. I started out as an HIV prevention researcher, and I started doing a lot of partnered work with community leaders, and guess what? The diabetes epidemic was happening. And it just turned out that diabetes just completely trumped the HIV, especially as people had, greater access to meds in the communities I was working in. And, and it's tough. I mean, in public health, luckily I was able to shift or to pivot. That's not always possible. So, if you have folks around the table who are, very singularly focused, you might have to be honest. Okay, listen, we might find out that your health issue is not the priority of the community. And so interests and level of involvement that are contingent on these, expectations might need to be kind of mediated in the process. And then a lot of partnerships will create an MOU, Memorandum of Understanding, for those who are a part of the partnership. I will say that as opposed to kind of community, like neighborhood governance, civic associations, block captains, and the like, to actually get community assessment work done does require some more dedication of staff and resources and time. And so MOUs can be, more helpful in this kind of circumstance than others. And there are great examples of community research partnership MOUs that can guide you, and I can send you some examples if you're interested, because it does kind of lay out like what my responsibilities will be, what the partnership will do, that kind of thing. And it's not like a contract per se that, you could sue them if they disappear, which happens, of course, sometimes, but it does sort of formalize those ground rules and those like levels of involvement and engagement that you guys talked about. But I think that the bottom line is that you want to try to maximize benefits and minimize risks. I mean, very few people do things out of the goodness of their own heart. It's usually because they feel passionately about their community, or they feel passionately about helping the community, right? There are reasons that people come to this work. And so figuring out those reasons and making sure that those everybody's enjoying those benefits to help support the work that they're either already doing or they're hoping to get into, helps to engage people in what can be a longer term process than just coming to a few community meetings. And then minimizing the risks, right? You want to think through all the various types of partners you might have around the table, you know, some potential benefits and risks. Like, of course, everyone hopefully will have a greater understanding of the assets and needs that you set out to understand. People have the data they need to advocate. The health agencies will have the data they need to plan. But, you know, we're doing work in the schools right now with Promise Neighborhoods, and the principals and the school's biggest concern, which is totally understandable, is that the data is going to reflect really poorly on them, or they're going to find things they didn't know about, right? And as you know, community members who are not a part of the process are going to feel very hostile toward these results if they're like, I don't know who these people were, or when they collected this data, and I don't understand these recommendations, but we were never involved in the process. So thinking about these things ahead of time and minimizing them through the planning process are really important.